One of the most important forms of care that we can give to residents is elder abuse prevention. The purpose of this program is to help you understand the most common forms of elder abuse so you can recognize it early and use strategies to keep it from happening.
It's hard to imagine someone physically abusing an elder, but it does happen. Imagine the emotional impact that physical abuse has on an elder.
According to the National Center on Elder Abuse, there are 7 types of abuse. There's physical abuse, sexual abuse, financial exploitation, denial of critical care by a caretaker, denial of critical care by the older adult, verbal and psychological abuse, as well as abandonment.
You'll learn to be more aware of the feelings and triggers that caregivers and loved ones can experience.
She would do things like when you try to give her medication, she'd put it in her mouth and spit it out. And as much as I tried to control myself, I could see myself becoming more angry in response to what she was doing.
For sensitivity to people living with dementia and to the viewer, some reenactments were done via animation.
One day when Judy is helping her mom get dressed, her mom becomes agitated. She slaps Judy on the hand and says, "Get away!" Judy is so stressed that she quickly raises her hand, causing her mother to protect herself by putting her arms in front of her.
Observe how actual caregivers use the evidence-based 5-step CARES approach to keep difficult situations from escalating.
Good morning, Merle. Merle. For C, or connect, I talked about fishing with Merle. He likes fishing, and so do I, so it's a common bond we have.
You been fishing lately?
With proper awareness and prevention techniques, many confrontations and feelings that lead to confrontations can be avoided.
So with physical or emotional abuse, when you observe that in a professional setting, you may feel uncomfortable approaching that individual. It's still your job and your duty to protect that patient.
The other type of abuse that I see frequently is financial exploitation, which can be just as devastating because you see these individuals who have worked hard their entire lives and see their life savings depleted.
Also, if you don't understand dementia and it's the signs that the person is going to exhibit with that or may exhibit with that, then you may think that the person is just choosing to act a particular way. Being human, our reaction is going to be, well, I'll lash out or say something back to you. So that's why it's so critically important to understand that. How do you take care of somebody if you don't understand what's wrong with them and the proper way to take care of them?
Through the CARES Elder Abuse Awareness and Prevention Program, you will learn to recognize potential signs of abuse, such as lethargy, certain types of bed sores, evidence of medical mismanagement, unsanitary environments, theft, and even exploitation by family and friends.
Common examples of exploitation include marketing scams, trying to cheat.
You'll also learn the many ways that you can engage local and state resources to report abuse and seek additional help.
Alzheimer's residents are much more vulnerable to being yelled at or being responded to in an angry or impatient way. It can be easy to ignore someone, especially if they're immobile and nonverbal. So you have to really train your staff to stay connected to those people, and because otherwise it's just easy to ignore them, and that's a real danger.
When I get older, I do not want to be treated like I'm not here.
I don't want to be treated like I'm a burden to somebody.
When I'm older, I want to be treated with respect.
I want to be treated as a person, a human being.